Hi, I'm Dr. Ray Plant. I'm very privileged to be a part of the Oklahoma Mission of Mercy, as I'm sure each of you watching this are also. All of us like to eat, and as lead of patient food, it is our job to make sure that each and every individual who comes into the door receives either a snack breakfast or a small lunch while they are there, adults and children alike. The breakfast is usually served the night before, and since treatment is usually on Fridays and Saturdays, Thursday evenings and Friday evenings are the best time to assemble the breakfast. We want to include 2 or 3 items in there, water, something like a banana, and maybe one other item. Consideration should be given to the fact that many of these patients are somewhat without teeth or partially without teeth, or they may have diseased or sensitive areas, so it's difficult for them to be able to eat certain items, especially hard items. So the softer, the better. Lunch usually would consist of 2 or 3 items, a sandwich, and maybe 2 or 3 other snack items, and also water to drink. As I said, the breakfast is usually positioned on the patient chairs. Whenever you come in the door, there will be a large seating area for all the patients with a registration clipboard on them. The breakfast, we discovered after doing this a couple of years, is best served by putting that on those same chairs where the registration areas are, and this is best done the evening before. In patient food, usually either volunteers or runners can help you distribute these. And sometimes wherever the location of the OkMOMs would be for that particular year, there are volunteers and youth and teenagers from that area who can also help do that too. But it is best to put the breakfast on the night before so all of these chairs can be filled and people can have them to eat while they're filling out their information. The lunch is usually served somewhere around 10:30 to 11 o'clock, and that is passed out in different blocks of areas. And no matter where the treatment setup is, there are going to be large blocks of seated patients. And it's important for the lunches to be distributed to each of those blocks. And again, the more volunteers, the better as far as being able to distribute the lunches to everybody. If there's one area we need to err on, it's to err on the side of making sure everybody has at least 1 meal, possibly 2, rather than have anybody not be able to get something. So we want to err on the side of too much than not enough. The faster the better when it comes to distributing the lunches, because a lot of people will get hungry and they want to know, can I have something to eat right away? As soon as all the lunches are distributed, basically our job is done. However, there's a lot of things a lead can do. They can help other people get to place. They can help other areas that need some assistance or things like that. Also, they can help out in the volunteer food area where a lot of the workers will come in for refueling in between their patients. By the time the OkMOM weekend experience is completed, all of you will feel much better knowing that all these people have left healthier, happier, and somewhat well-nourished.